Hello there. My name is Cyrus Shiran. I am a human biology graduate from Michigan State University, and this is the YouTube version of my So You Want to Be a Medical Doctor presentation. Real quickly, I'd like to apologize in case the audio isn't best or this sounds kind of disjointed. In full disclosure, this is my first time recording myself and making a video like this, so if it sounds kind of weird, I do hope you'll bear with me. Okay, so presentation overview. Put simply, the goal of this presentation is just to give you a rudimentary understanding of various doctoral level healthcare professions. If you see this list, these are all the professions we're going to cover today. And hopefully, as you're listening, you may find one or two that you're like, oh, I really like this one. And if you do, I encourage you to do some research on your own or follow up with your college advisor on how do I become a podiatrist or whatever you find, whatever you fancy. All right, without further ado, we're going to start with Doctor of Allopathic Medicine or the MD. So, MDs are physicians who can practice in all 50 states. They can do surgery or medicine, depending on what they choose to specialize in. They also may choose to treat the whole body, including, your primary care physician or a pediatrician, or a single organ system, so that your ophthalmologist will focus on the eye and your cardiologist will focus on the heart. The MD degree is one of the oldest and most well-known degrees, and it's arguably the most competitive. So if you've ever seen a medical drama on TV, someone with a white coat and stethoscope, they're probably an MD. Research is an important part in many MD programs. In some schools, like Oakland University's MD program, it's actually a requirement to graduate. So when researching schools, you should decide how much research you want as a part of your education and choose schools according to that. Okay, how do you become an MD though? Well, you start off with 4 years of undergraduate, and sometime during your undergraduate or a little bit after, you take the medical college admissions test. This test, along with your GPA and other activities, will be reviewed, and if you do well, you get accepted into medical school. During medical school, you have another test to take. This is the United States Medical Licensing Examination. As the name suggests, this is for getting your license and being able to practice. And then lastly, you have a 4+, depending on specialty, training period known as residency. And this is basically to determine what kind of doctor you will be. So after you graduate, you get your MD, but you're not like a neurologist yet. You still have some more training to do. If you do want to become a neurologist, you would do 1 year of internship, and then you do 3 years of what we call neurology residency. Afterwards, you become a neurologist. Uh, Debt from tuition to income ratio. So MDs usually take about $200,000 of debt, and they will make anywhere from 250K to 750K. This number of income varies based on their specialty. Some specialties make more, some specialties make less. The debt, on the other hand, depends somewhat on what school you pick. Private institutions have usually a flat rate. Doesn't matter where you come from, you pay one rate for tuition. Public schools, on the other hand, will give cheaper tuition rates to their in-state medical students and will charge higher tuition for out-of-state medical tuition. MDs are represented by the American Medical Association. Okay, two famous MDs. On the left, we have Dr. Ken Jeong. Dr. Jeong is a famous actor, and he's known for many shows, one of which being a show called Dr. Ken, where he kind of depicts his life as a physician. Over here is a physician who needs no introduction, but I'll give him one anyways. Dr. Anthony Fauci. Dr. Anthony Fauci was the head of the coronavirus task force under President Donald Trump and is currently chief medical advisor to President Joe Biden. All right. So, if you're still with me, up to now, you've probably heard of an MD. You've probably, coming into this presentation, knew what an MD was or had a good understanding. But I'm guessing you probably haven't heard of a DO, and there's also a good chance you've been treated by a DO and you may not have noticed. That's because as doctors of osteopathic medicine, or DOs, uh, pretty much do what MDs do. They can prescribe medication, they can do surgery, and they can practice in all 50 states. They take the same classes, and they even train under the same ACGME accredited residency programs. What's unique or different about DOs is two things. For one, Osteopathic Medical School teaches OMM. OMM, otherwise known as Osteopathic Manipulative Medicine or Osteopathic Manipulative Treatment, OMT, is manual therapy and it's used to treat mechanical pain. So this would include things like muscle pain, tendon pain, bone pain, and even migraines. It's very, to me, it's very amazing because it's a non-pharmaceutical approach. Next, the next difference is a holistic approach to patient care. So essentially, DO schools were founded on the principle that the patient is a whole, and you need to approach caring for them as you would care for the entire person, not just focus on one disease. Quick disclaimer: this does not mean MDs do not practice medicine like this, but DO schooling is unique in that it emphasizes this. All right. Something really cool about osteopathic medicine, or as it was known back in the day, osteopathy, is that it's a uniquely American medical tradition. It was founded by Andrew Taylor Still, who was a Civil War surgeon. And a little story behind this is shortly after the death of his wife and three children, A.T. Still became dissatisfied with the current medical practices of his time. So what he did was he developed his own approach to medicine, and he called it osteopathy. And he eventually founded the first DO school, which is known as the American School of Osteopathy in Kirksville, Missouri. Later on, it would go on to be known as A.T. Still University College of Osteopathic Medicine, and you can actually get a DO there today. So if you're interested and you'd like to train at the very first DO school, you can do that. So DOs tend to focus on primary care, and they usually pick specialties such as family medicine, internal medicine, pediatrics. These three are generally considered primary care specialties, as well as other specialties like PMR and psychiatry. PMR is very manual medicine rehab focused, and it aligns well with DO's OMM, so that's why they're very drawn to it. I'll talk a bit more about these residencies again later on. So, how do you become a DO? Well, if you're looking at this, you're probably seeing a lot of overlap with MD. That's because their education is almost exactly the same. There's a few key differences, though. Number one, DOs will attend osteopathic medical school and practice with a DO rather than allopathic medical school. Number two, they still take the MCAT, but their licensing exam is different. They take the Comprehensive Osteopathic Medical Licensing Examination, which is very similar to the USMLE. And the last difference is they are represented by the American Osteopathic Association, or AOA, as well as the AMA. The AMA kind of just represents physicians as a whole. Uh, Debt from tuition to income ratio. So you may notice this number is a little higher than the MDs, and that's not so much because DO schools are more expensive, but because MDs have more public schools available to them. So if you're an in-state applicant and you go to a public MD school, you'll be paying a lot less than you would at a private school or out-of-state public school. Whereas DOs have more private schools available to them. I believe the only two public DO schools are Michigan State University and Ohio State University. But as for income, there is no difference. An MD family physician will make what a DO family physician makes. An MD neurologist will make what a DO neurologist makes, and so on and so forth. All right, two famous DOs. So on the left, we have Dr. Mike Warshawski, and on the right, we have Dr. Sean Conley. So Dr. Mike is a YouTuber, and his content primarily focuses on popular medical media. Think your House MD or your The Resident, and he'll watch scenes with his viewers, and he'll talk about what's accurate, what's inaccurate, and kind of his YouTube channel focuses on giving the general public kind of an insider of what medicine is like and exposing them to myths and inaccuracies, as well as what is accurate about these kind of shows. I personally enjoy his content. Dr. Mike is a graduate from New York Institute of Technology College of Osteopathic Medicine, and he was trained in family medicine. Over here, we have Dr. Sean Conley. So, politics aside, Dr. Sean Conley was the personal physician to Donald Trump, and he most notably served under Trump when he got COVID 19. Dr. Sean Conley graduated from Philadelphia College of Osteopathic Medicine, and he was trained in emergency medicine. Okay, so as I promised, what are the different medical specialties? I think this chart is pretty hilarious. Not the most accurate, but definitely funny. So I'm going to go through and explain the various medical specialties, and just keep in mind that I'm giving a very simple definition. If any of these interest you, feel free to do a deep dive and really learn what they're about. Okay, so we're going to start with family medicine. Family medicine is essentially, as the joke says, the I like everything specialty. You are a doctor who learns a bit of pediatrics, a bit of OBGYN, and a bit of internal medicine. And the whole goal with a family doctor is you will take care of a patient from birth to old age. Most family medicine doctors become primary care physicians. Then, starting from right to left, we have physical medicine and rehabilitation. As I hinted at before, PMR is a specialty that focuses on the rehab of patients. They're in charge of coordinating rehabilitation care. So they work with physical therapists, occupational therapists, speech therapists, neurologists oftentimes, and they create long term goals for their patients. Psychiatry focuses on managing the mental health of patients. And don't get this confused with psychology, which we'll talk about at the end of this presentation. But psychiatrists are medical doctors, and they oftentimes will manage medication as well as do psychotherapy. Anesthesiology is the specialty that concerns itself with evaluating and monitoring patients prior to, during, and after delivering anesthesia. Their job is usually to make sure patient vitals are stable and there are no undesired reactions. Neurology is the specialty that focuses on, you guessed it, the nervous system. So neurologists cover the peripheral and central nervous system, central being the brain and spinal cord, and they deal with things like strokes, seizures, or epilepsy, and neuropathy. Pathology, right next to neurology, and radiology, right next to dermatology. These are two diagnostic specialties. Pathologists will focus on cells, histology, and the origin of disease, and radiology will focus on imaging, such as X-rays, CT scans, and MRIs. Next, we have internal medicine. So if you're looking at this and you're like, hey, where's cardiology? It's kind of here. Internal medicine doctors are doctors who, if you've ever seen one of those old medical shows where a patient comes in with a mysterious illness and the doctor goes through, does research, figures out what it is, that's kind of how internal medicine works. You're essentially an adult provider and you focus on the entire body, but you can also subspecialize with internal medicine. So after you complete internal medicine residency, you can go on to do a few more years of training and become an internal medicine doctor who has a fellowship in a different field. So you can get a fellowship in cardiology, gastroenterology or GI, pulmonology, critical care, nephrology, etc. Emergency medicine. Emergency medicine deals with people who need care as soon as possible. They can't wait for clinic on Monday with their family practice doctor, right? Emergency doctors have essentially three outcomes with patients. Number one, a patient doesn't really need care. It's something that can be seen later or they can recover from on their own, in which case they'll discharge the patient. Number two, something that does need to be seen urgently, but they can take care of themselves. And number three, something that needs to be seen urgently, but they'll need to admit them to the hospital first. So maybe they need to admit them to neurosurgery or internal medicine. Uh, General surgery. General surgery is almost like the internal medicine of surgery. You do things like appendectomies, and you deal with basically anything that isn't another surgical specialty, which we'll talk about a bit later. OBGYN focuses on women's health. This includes the female reproductive system, pregnancy, and childbirth. They are also surgeons. Ophthalmology is surgical and medicinal care for the eye. Dermatology is care for the skin. Neurosurgery, as the name also suggests, are surgeons who focus on the brain and spinal cord. Urology are surgeons and physicians who manage the urinary system, as well they help take care of the male reproductive system. Plastic surgery focuses on cosmetics and reconstructive surgery. A lot of times, burn victims will get help and treated by a plastic surgeon. And lastly, orthopedic surgery focuses on the osteon, or bones, of the human body. All right. So if you were looking at the specialties we covered earlier, and you're like, hey, where's the foot doctor, the podiatrist? Well, actually, podiatrists aren't MDs and DOs. They have their own degree. They are known as doctors of podiatric medicine, and they are podiatric physicians and surgeons who specialize in the foot and ankle. They can prescribe medication, perform surgery, and essentially act as MDs and DOs, but only within the bounds of the lower extremity. So D.P.Ms go to podiatry school rather than medical school, but they still take the MCAT. And so how do you become a D.P.M, right? Well, a D.P.M requires, much like MD-DO, 4 years of undergraduate and an MCAT. But afterwards, you apply specifically to podiatry school. And then after that, you do 3 years of podiatric residency. All podiatrists, as of now, back in the day, it used to be a little different. All podiatrists are both surgeons and physicians. They train with medicinal care of the foot and surgical care. Back in the day, you could choose to just do medicinal care of the foot and have a 1 year residency, but the APMA wanted to unify it so every podiatrist can do both. So now all of the residencies are 3 years. So debt to income ratio for a podiatrist, you take about 150K in loans and you'll make about 130 to 230K a year. And podiatrists are represented by the American Podiatric Medical Association. All right. So real quickly, I wanted to cover a few pathologies and cases for podiatrists. So like I said, podiatrists manage both medicinal aspects of the lower extremity and surgical. So heel plane, plantar fasciitis, Achilles tendonitis, etc. But they also work with things like diabetic wound care or fungus. So you have to have a strong stomach if you're going to be a podiatrist. Here we have a flat foot case on the right. And I just thought this was very interesting because it kind of shows the order of treatment in podiatry. So you have a patient with flat foot. Flat foot is basically when the arches of the inside of your feet are flattened and it causes pain. So you obviously want to alleviate this pain if it becomes intolerable. So you start with a more conservative approach. You may recommend orthotics, which are inserts you put into your shoes, and physical therapy of the Achilles tendon. Now, if this doesn't work, you can perform surgery. And if you look at this before and after diagram, you could see how the surgeon basically created an arch over here to help alleviate the pain in this patient. So I just thought this was really cool and a good example of a conservative approach to taking care of a patient and then a surgical approach. Okay, next up we have Doctor of Dental Surgery, D.D.S, and Doctor of Medicine in Dentistry, D.M.D. So you guys probably are familiar with dentists as well. Most of you have probably been seen by a dentist or an orthodontist. Let's start with the degree first. So there is no difference between these degrees. The story of it is actually pretty cool. So back in the day, the very first dental schools offered the D.D.S, Doctor of Dental Surgery degree. And when Harvard chose to open its own dental school, they ran into a little bit of a problem. So Harvard only gives degrees in Latin, and D.D.S becomes something that is very difficult to pronounce and is like CDD, and that seemed very cumbersome. So what they did is they came up with their own abbreviation. Basically, they took the M.D. degree and added an extra D. So you get Doctor of Medicine in Dentistry, which in Latin is like Dentera Medense Doctor. Sorry, that was probably a really bad pronunciation, but you get the idea. So now dentists have two separate degrees, one D.M.D, one D.D.S. However, there is no difference whatsoever. All right, dentists are healthcare professionals who provide care for a patient's teeth and gums. They can prescribe medication and perform minor surgeries within the respect of the oral cavity. Some dentists, though, choose to become oral and maxillofacial surgeons, so like jaw and upper jaw surgeons. In order to do this OMF surgery, they need to spend 4 to 6 more years in school. So the 6-year programs, by the way, will also grant them MDs, which is pretty cool. And then others may choose to specialize in fields like orthodontics or braces and endodontics, root canals. And we'll talk more about root canals later. I think they're pretty cool. General practitioners or GPs can just practice. They don't need a residency. So how do you become a dentist? Well, the bare minimum is this: 4 years of undergraduate, during which you'll take the dental admissions test, and 4 years of dental school, during which you'll take 2 board examinations. Afterwards, you can practice as a dentist. Dentists tend to take about 300K in loans and make anywhere from 150 to 250K as a general practitioner, and then oral surgeons make around 300 to 500K a year. And that's mostly because they spend so much time in school, they're higher compensated. Dentists are represented by the American Dental Association. All right, so I want to briefly talk a little bit about some dental pathologies. We'll start with root canals. So what a root canal is where you see in this diagram, you have something called the pulp, which is nerves and blood vessels. What happens here is this gets infected. And this is very dangerous. It's extremely painful too. So what a dentist does is the following. They'll first drill an opening, and then I thought this was so cool when I first learned about it. They just remove all of the pulp. They don't try antibiotics, they just get rid of it, and it's probably not very practical to try antibiotics in this situation. So they just get rid of it all. And then they put some sort of filling and sometimes a post. So they cover it up, as you can see in this diagram, and cover it with a crown. Something very interesting to note here, this is a very delicate procedure. If they leave some gaps and saliva gets in with bacteria, it could get infected again, and you could even lose a tooth. So imagine having a root canal done. It's painful, oftentimes expensive, and you end up losing tooth anyways. So that's why dentists have to be very careful when performing root canals. If worse comes to worse and you lose a tooth, you have another option. These are what we call dental implants. So these are artificial tooths, and rather than having the two little prongs of the teeth in your bone, they just drill into your mandible right here in the cortical bone, and they basically give you an artificial tooth. And this is used for mastication or chewing your food, and it has cosmetic appeal as well, because no one really wants a gap in their mouth. Lastly, I wanted to talk a bit about wisdom teeth. So wisdom teeth are teeth that come out when you're about 17 to 20 years old. Hence the name wisdom teeth, because as a 20-year-old, you're extremely wise, right? And the problem, though, is oftentimes they come out impacted, which essentially means they're going to collide with your other teeth, specifically your second molar. And this is extremely painful and not very pleasant. So they just extract these teeth. I had my wisdom teeth extracted, unfortunately. And there are some cases where the wisdom teeth come out nice and straight, and you don't even need the surgery, which I wish was the case for me, but it was not. Okay, next up, Doctor of Optometry or OD. So optometrists, not to be confused with ophthalmologists, provide medical care for the eye, but they do not provide surgical care for the eye in most cases. They'll manage things like infections, glaucoma, macular degeneration, etc. And they can prescribe prescription eye glasses and eye drops. Really, you can think of optometrists as the primary care physician for the eye. Uh, MD/DO ophthalmologists can also medicinally manage the eye, but they perform surgery as well. There are some states, however, where optometrists can perform surgery, but even in those cases, they generally do not. So, how do you become an optometrist? Well, an optometrist requires about 8 years of school, much like a dentist. You do 4 years of undergraduate and 4 years of optometry school, and afterwards you earn your OD, or Doctor of Optometry. Before optometry school, you take the Optometry Admissions Test, or OAT, and afterwards you take 3 board exams. So to become an optometrist, you generally take out 180K in loans, and you'll make around $100,000 to $150,000 a year. Optometrists are represented by the American Optometric Association, not to be confused with the American Osteopathic Association. And much like with dentists, here are some cases for optometrists. So on the left, we have glaucoma. Glaucoma is basically a group of eye disorders that cause damage to the optic nerve. You can see the optic nerve in the diagram. And it's due to a buildup of pressure. And while this cannot be treated, you can manage it. And generally, to manage it, you'd simply decrease intraocular pressure, usually by prescription eye drops. Over here, we have conjunctivitis. Conjunctivitis is an infection of the membrane. If you can see where my mouse is moving, or the arrows, that's usually where it happens. And much like with any infection, you can treat this with antiviral or antibiotic medication. Okay, Doctor of Pharmacy. So I always thought pharmacists were really cool. Pharmacists don't see patients in the same way any of these other professions see. They don't generally provide treatments. Rather, their job is simply to dispense and medication and fill prescriptions. Not only that, they also can provide counseling on OTC, or over-the-counter medication. That basically means you don't need a prescription for it, or prescription medication. And as you probably know, with the COVID-19 pandemic, they can give vaccines as well. So what I find really cool about pharmacists is they're oftentimes the last line of defense between a patient and a prescription. What do I mean by that? Well, the example I always use is this one. Let's say you have a patient who was given Wellbutrin by a mental health provider. But if you look at this patient's medical records, you'll see that this patient suffers from epilepsy, which is currently managed by a seizure medication. Epilepsy, by the way, is a condition in which basically the neurons in your brain are disturbed and you get seizures. So the danger about this is this. Wellbutrin, the antidepressant, can lower your seizure threshold. And that may mean that even though you're taking anti-seizure medication, you can still have a seizure. Now, in most cases, your mental health provider will go through great lengths to ensure that this isn't the case. But hypothetically, because providers are humans, let's say they miss this. Well, a pharmacist will look through your records when dispensing the medication, and they can catch this, and they'll call up the provider and say, "Excuse me, uh, have you checked with their neurologist to make sure they can take Wellbutrin because they have epilepsy?" And so they can catch this, and I think that's very amazing. So, how do you become a pharmacist? Well, pharmacists require 4 years of undergraduate and 4 years of pharmacy school. Before pharmacy school, they take the pharmacy college admissions test, and if that goes well, they become pharmacy students. So pharmacists make about 100 to 150K a year, and they take about 180K in loans. And lastly, they're represented by the American Pharmacists Association. So while pharmacists don't really have cases they manage per se, I want to talk a little bit about the science behind pharmacy. If you're interested in pharmacokinetics, which is kind of like how is medication absorbed, how is it broken down, where does it go, and how does it leave your body, or pharmacodynamics, which is basically kind of like what do different concentrations do, and how do these mechanisms work. If you're interested in any of that, so you take a pharmacology class in college and you love that, pharmacy might be a great career for you. Okay, so as I talked about back when we talked about MDs and DOs, we have the Doctor of Psychology, PsyD, and Doctor of Philosophy and Psychology, PhD, both of whom can practice as clinical psychologists. So we're going to start with differentiating a psychologist with a PsyD and a psychologist with a PhD. So a PsyD is essentially a clinician's degree. They tend to be about 4 years, have less research requirements, and less time in school. However, they tend to require you to pay full tuition. A PhD is a researcher's degree in most cases. So a PhD, they tend to be a bit more competitive. They require more time in school, and you have to not only do research but write what's known as a doctoral thesis. Any PhD program will require you to write a thesis, by the way. Uh, However, on the other hand, for PhD programs, in a lot of cases, you're likely not only to have your tuition covered, but you're given a stipend. So you work as a teaching assistant or a research assistant, and you get paid a small amount of money a year to basically live off of. Both PsyDs and PhDs can work as clinical psychologists and treat patients in clinics. PsyDs, again, tend to focus more on clinics, and PhDs tend to focus on research as well as clinics. So, what do clinical psychologists do, though? Well, clinical psychologists provide psychotherapy. If you can also call it talk therapy. So, if you see a TV show, you see someone on a fancy, comfortable-looking couch, and like, doc, I'm having some trouble with my wife lately, etc. Right? That's likely psychotherapy. They can treat anxiety, depression, personality disorders, etc. If they are PhDs, they likely will do research. Psychiatrists, however, are MDs and DOs. They can prescribe medication and they handle patients who have more complex medical background or they need medical management. So, to become a clinical psychologist, you generally need to take the GRE and then you also need to take the psychologist licensure board examination. PhDs also really need a research background. It's very difficult to get into a PhD program without sufficient research. PsyD programs don't really care about research as much, but if you have research, you probably become a more competitive applicant for them. Clinical psychologists will earn about 80 to 120K a year, and they take about 120K in loans. And real quickly, here are some common mental illnesses. So when I was studying for the MCAT, I thought this section was really cool. And if you find yourself really drawn to these, I definitely recommend looking into becoming a psychologist or a psychiatrist. So we have anxiety disorders, substance abuse disorders, psychotic disorders, mood disorders, personality disorders, and eating disorders. And there are more, but these are uh, broad categories you can look at. Okay, last but certainly not least, Doctor of Philosophy in Genetics, Immunology, Biomedical Engineering, etc. So let's say you're interested in some facet of medical science, but you don't really want to work in a clinic and you don't really want to treat patients, just something you never were passionate about. A great option for those interested in medical sciences and research is the PhD path. So you can get a PhD in almost any field as long as it's from an accredited university. And much like with your clinical psychologist PhD, it's very similar. You take the GRE, you complete a doctoral thesis, and most programs cover tuition and grant stipends to students. After you graduate, you'll work in either academia, so you can be a professor, climb up the ranks that way, or you can work in research and development in private industry. Uh, Interestingly enough, if you're interested in clinic work but you really want that extra training in research, a lot of the aforementioned programs will offer dual degrees. So you'll see the M.D. Ph.D., D.O. Ph.D., D.D.S. Ph.D., D.P.M. Ph.D., etc. These degrees tend to add 3 to 4 years to your schooling, but in return, they tend to help cover your tuition. So as a clinician scientist, you'll be doing research, you'll treat patients. These programs are very competitive. However, they make you very desirable for academic programs. So keep that in mind. All right. Thank you so very much for listening to me. If you have any questions, feel free to put them in the comment sections and I'll try to answer them. Again, I do want to apologize if this sounds disjointed or kind of weird. I'm not too used to this program, but I do hope you got some useful information from this. All right. Thanks again.